Hello, everyone. My name is Christina Putinaita, and I am mental health nurse practitioner student. And today I will be discussing adolescent mental health, focusing on vulnerable teen populations. Many at-risk teens, such as those from low-income families, rural areas, or marginalized communities, struggle to access mental health care. As a future psychiatric mental health nurse practitioners, we have responsibility to advocate for these youth and implement solutions to improve their well-being. Adolescence is a critical period for mental health, yet many teens face challenges like trauma, discrimination, and financial barriers. Without intervention, these issues can lead to academic struggles, social difficulties, and long-term mental health disorders. Unfortunately, access to health care remains a major issue, particularly for those in underserved areas. Addressing this requires targeted interventions and policy changes. Um, to analyze the issue, rural teens often lack nearby mental health providers, while urban teens may face stigma, financial hardship, and overburdened healthcare systems. Studies show that untreated mental health issues can result in poor academic performance, substance abuse, and an increased risk for suicide. As PMHNP, we must not only provide direct care but also work to remove these systemic barriers. My plan for overcoming challenges is to improve access so we can expand telehealth services, allowing rural teens to receive virtual care. School-based programs provide early intervention in a family setting, reducing stigma and increasing access. Community outreach initiatives can connect at-risk youth with resources, and advocating for policy reforms, such as increased mental health funding, can ensure long-term solutions. PMHNPs must lead these efforts. And to conclude it, adolescent mental health is a pressing issue, especially for vulnerable youth. As PMHNP, we play a key role in breaking down barriers through advocacy, community programs, and policy change. By working together with schools, organizations, and lawmakers, we can build a system where all adolescents, regardless of the background, receive the care they deserve. And there are like few questions to discuss. So like number one would be, how can schools and community groups better support your mental health? And the second one would be, what policy changes are needed to improve access to care for vulnerable adolescents? And this presentation is supported by research from the World Health Organization, the American Academy of Pediatrics, and our scholarly sources emphasizing the urgency of adolescent mental health advocacy. Thank you very much for your time. Mental health advocacy starts with awareness and action. I encourage you to reflect on how we, as future healthcare providers, can make a meaningful impact.